So I get really bloated and constipation. I have celiac and SIBO. I'm very careful with food. I looked at the list in the email, and that's what I do. Please help. Gina, if that's the case, if you're doing everything you know to do and you're still struggling, you've got to get tested. Like at the end of the day, I have an adage, and this is in No Grain, No Pain. It's in one of the very last chapters of the book. Test, don't guess. Everybody's unique and different. One man's food is another man's poison. You could be reacting to the most healthy foods in the world. I've seen cases, one of the stories in No Grain, No Pain that I wrote about, it was Ginger's story. She's a little girl with a terminal diagnosis. She had 6 months. Her rheumatologist gave her mom, he said, your daughter has 6 months to live. Go home and get ready. She's going to die, right? And this little girl, aside from being gluten sensitive, was allergic to blueberries. And had we not tested her, we never would have found that out. We never would have gotten a resolution in her case. So this goes back to you test, because you may be doing everything right. You may be following No Grain, No Pain exactly as spelled out, but you also may be reacting or allergic to some of the things that are, generally speaking, are healthy things, but for you they're not. And that's really where you've got to get clarity. And testing is what helps to provide that clarity. Let's see here. What about heavy metals and gut inflammation? Well, heavy metals can certainly cause it. And where do most people get exposure to heavy metals? In today's world, if you're a massive fish consumer, there can be mercury in a lot of the bigger fish, like your larger cold water fish can contain mercury. But where a lot of people get exposure to heavy metals, you're never going to believe me when I say this, one of the places is rice. And rice has been shown to contain cadmium in high amounts, arsenic, and lead. These are heavy metals, right? And then you also have halide, which isn't a heavy metal, but fluoride also can damage the gut. And where do we get fluoride? Every day. If you drink city water that's fluoridated, if you're in the U.S., the water's fluoridated here. If you're not filtering that nonsense out, you're getting hammered with fluoride. Remember, fluoride's also a pesticide, so it destroys your microbiome, as does chlorine. We could put chlorine on this list as well. These things are not good for you, but they're put in all of our water in an attempt to prevent cavities with fluoride, that's nonsense. And then the other with chlorine, it's to prevent bacterial infection or spread through water, which is not a bad idea, but you do want to filter it out, before you drink it, so that you're not just chlorinating your GI tract constantly, because both of these substances are natural antibiotics. I mean, they're gonna knock out your flora over time the more you consume them. So heavy metals through that, and then the other place we see heavy metals really is kale. Kale is one of the biggest sources of thallium exposure. And a lot of people juice kale en masse, right? They buy all this kale and they just dump it in the juicer. And I see it all the time, thallium toxicity in people that are aggressively juicing. This is especially true in people in the vegetarian community who eat in my opinion, an overabundance of it. And there are a number of reasons why. Thallium is commonly found in organic fertilizers, and kale is like a thallium magnet. It just pulls it right out of the soil. It detoxifies the soil, but now you have to contend with it if you're doing a bunch of kale juicing. How long would it take to feel a reduction in pain after stopping grains? It's different for different people, Robbie, but most people within 2 months are noticing some pretty dramatic change and improvement. I just talked to somebody earlier today, and she has only really been going grain-free for a few weeks, and she's already noticed a dramatic improvement in her pain levels. So, again, everybody's story is different, but for most people, a couple of months, unless you're missing a major key element. When should you follow up after having an initial food sensitivity test? When should you follow up what? When should you follow back up with your doctor? I don't understand your question, Morgiana. Maybe clarify it a little bit more and I can give you a better answer. Is gray hair an indication of food malabsorption? Depends on when you get the gray hair. So if you're really young and you're already seeing premature graying of the hair, yes, it can be. Graying hair early it can be a symptom of vitamin B12 and vitamin B5 deficiency. So, again, that's saying that maybe you're malabsorbing nutrients, and B12 and B5 are two of the nutrients you're malabsorbing. Gray hair can certainly form. There's also something called a flag sign, which is like a patch of gray hair that clusters in one region or one location. That's very, very common to see that symptom physically. What do you recommend for somebody who's had their gallbladder removed? If you've had your gallbladder removed, you've got to really understand that you've got to have some type of help with. One of the things I recommend is a product called Lipogest, and it's got bile and some other ingredients that help you to emulsify and digest fats and fat-soluble vitamins appropriately. It's called Lipogest. And so that's something, again, your surgeon should have had a pre-nutrition surgical consult to inform you that may be something that you need to do to support your ability to digest fat as you move forward in the world without a gallbladder. But that's one of the supplements I recommend to support your ability to properly absorb fat. Let's see, Sheila says, other than all the other intestinal issues like celiac, lymphocytic colitis, and diverticulitis, a gluten-free diet wasn't helping. No matter what I eat or drink, I immediately have bloating pain. Had a current EGD done and was diagnosed with pyloric stenosis, gastritis, and my GERD was so bad it's inflamed my esophagus to the point of losing my voice intermittently. I understand that pyloric stenosis is rare for an adult, very rare as a matter of fact. Are these newer issues tied to the original issue? Yes. So I've seen cases of pyloric stenosis where gluten was responsible for the damage. So understand that those of you who don't know what pyloric stenosis is, there's a valve in your stomach, and what happens is it won't release, it won't open, and so the stomach contents will regurgitate back up into the esophagus, creating inflammation and irritation. And it's more common in pediatric kids, like kids who are very, very young. When we're talking about before the age of 2, it's very uncommon in an adult. But they can do a surgery where they can release that valve. They can basically open it up so that it's no longer happening. But it's possible that, you haven't been gluten-free, I would imagine, your entire life, but it's possible that gluten caused it, and the damage was so severe that even getting off the gluten, the damage was still very, very bad, and it couldn't fully heal because once that valve was constricted and not releasing, things just kept regurgitating up. So that's a potential reason as to why. There certainly are other reasons, but if you have that released, or I don't know what your doctors are doing with you, but once you get that corrected, you should still maintain a good diet, because that's what's going to keep you healthy as time goes on. How do we resolve swallowing issues? Depends on why you have swallowing issues. So, you can have swallowing issues for a lot of reasons. For some, you get spasm in the esophagus that narrows and constricts it. For others, enlargement of the thyroid can put pressure into the throat. For others, tonsillar swelling can make it harder to swallow. For others, sympathetic tone, and too much sympathetic tone can make it harder to swallow. I mean, it's not a simple question, and we could probably do a whole show on swallowing conditions. But I would say start with diet change. Start with diet change first. And if you're having trouble, one of the things that we have people do who have really severe swallowing issues is we have them puree their food. So get you like a good Vitamix, industrial blender, and puree a lot of your foods into, liquefy them so that you don't have to chew and you don't have to swallow big bits. It goes down a lot easier, more in a liquid form. And sometimes people have to do that temporarily until they actually heal. Does malabsorption create or help induce non-alcoholic fatty liver disease? It can, because your liver needs key nutrients are required for your liver to properly process fat. And so when would your liver store fat? Well, number one, we talk about choline. and inositol. These are two B vitamin-like compounds that, when deficient, contribute to fatty liver, because your liver requires these two compounds in order to properly metabolize and deal with that fat. So malabsorption can lead to choline and inositol deficiencies that could contribute to fatty liver. We'd also add B12 to that list, because B12 deficiency can also contribute to fatty liver. Leaky gut can contribute to fatty liver because of certain bacterial toxins can leak across an intestinal permeable situation, directly go to the liver and cause liver damage. So lots of things can do that, but malabsorption certainly on that list. Let's see here. Do you have any recommendations for genetic APOE E3, E4? Just got these results today. LDL 164, total 255, triglyceride 73, gluten-free, awesome, feel good. So my advice, Elizabeth, is simply this. APOE Genetics, for those of you maybe don't know, some will say that if you have APOE 3, 4 genetics, then it increases the risk of dementia and heart disease. I don't agree. I think we might see that there is a genetic preponderance toward that, but not if you're doing all the things right in your diet and your lifestyle. And so my recommendation is you get customized with your diet, with your exercise, with your sleep, with your sunshine, your air quality, and don't keep yourself awake over worry, because generally speaking, your genetics don't determine your fate. And a lot of practitioners I see, this is especially true in today's world, they do all these genetic tests, and then they want to pump you full of pills based on your genetic variances, or what are called SNPs, single nucleotide polymorphisms. And the vast majority of cases in time, people shouldn't supplement their genetics, because you understand your genes aren't to blame. It's not your genes, it's your choices. And if you have certain genes and you make certain choices, then you have a greater risk. You can't change your genes, but you can change your choices. And so most people try to change their choices passively by taking on gobs and gobs of pills to overcompensate for a genetic mutation. And it's the very wrong approach. As a matter of fact, I can speak from about 5 years of clinical experience. I helped design one of the very first genetic SNP tests direct to consumer available. And what we saw in years of research of trying to address SNPs with nutrition is we saw outcomes weren't very different. The things that made the most difference wasn't how many supplements or pills you threw at somebody because of a genetic mutation. It had more to do with changing their diet and changing their lifestyle parameters and behaviors. So again, I hope that's helpful for you. Let's see. Is beef collagen or grass-fed beef okay when you have a fibroid? I have one, was told it is the size of a woman that's about 7 weeks pregnant. Don't want things that would make it bigger. So beef is generally just fine. Beef and collagen both, unless you're allergic to beef or wherever you're deriving your collagen from. People can be allergic to chicken, can be allergic to beef, and so if you're using chicken or beef collagen or even fish collagen, if you're allergic to the source of the meat, then yeah, that might not be a smart move for you. But as a general thumb, no, collagen grass-fed beef do not make a fibroid worse. They're not, fibroids are not caused by protein. If they don't have their gallbladder, is it affecting the heart health and make people store fat in their arteries? No, remember, the gallbladder doesn't cause heightened or increased fat in the bloodstream. When you don't have a gallbladder, so an absence of gallbladder doesn't cause fat in your blood. An absence of a gallbladder prevents you from absorbing the fat into your blood. So it would, it would be the opposite of what you're saying. Now, don't get me wrong, if you're malabsorbing omega-3 does thin your blood, keeps your blood viscosity nice, and prevents inflammation in your arteries. So malabsorbing, not getting adequate omega-3, could increase your risk for heart disease because you need omega-3 to be heart healthy. But lack of gallbladder leads to not enough fat in your bloodstream, not too much fat. Remember, when we're talking about absorption, we're not talking about absorption from your blood to your cells. We're talking about absorption from your gut to your bloodstream. That's when we use that term malabsorption. We're talking about, are you absorbing the nutrients from the GI tract, from the, the axis of the GI tract into the bloodstream directly? Heather asks, my gallbladder was removed in 1998 when I was 18, but I gained weight so easily and losing it is difficult. Can that be malabsorption? It can be a lot of things, Heather. Yeah, I mean, not having enough fat, not getting enough fat. There's certain fats that are critical for weight loss, like CLA, conjugated linolenic acid, is very helpful in weight loss. And so it's possible that malabsorption is playing a role in that. It's also possible other things are playing a role in that. On a gluten and dairy-free diet, can I have green peas and pasta? Yes, you can, just if we're talking about strictly gluten-free. Now, if we're talking about no grain, no pain, phase 2, we cut out legumes during that phase. And again, not everybody needs to cut out peas and legumes, but this is, again, generalized in the diet, no grain, no pain. We do cut those out during phase 2 because some people have a harder time digesting them. Can low stomach acid cause malabsorption? Angela, yes, it can. Again, I mentioned this earlier, malabsorption of vitamin B12, malabsorption of minerals, and malabsorption of protein. I believe as family members losing muscle mass, 20 pounds underweight due to high alcohol consumption, what supplements may I suggest to help with this problem? Sadly, he doesn't want to address the alcohol issue. Rita, that's unfortunate, and I hate to hear that because there's not a real great answer. I would say if you're going to do anything, one thing that might be positive, beneficial would be a very good B complex. So B complete would be what I would recommend. You might also have them use Ultra Nutrients, which is our multivitamin, multi-mineral, but just to get some nourishment into them. Alcohol consumption in high levels causes severe malabsorption and severe liver damage. And it causes B vitamin deficiency in a very big way. And so, it's the best you can do if he's not willing to cut out the actual problem, which is high levels of alcohol consumption. Is a functional medicine doctor or naturopathic doctor capable of handling this kind of malabsorption issue? Debbie, it just depends. I mean, a lot of times people ask me, can you refer me to a doctor in this area or in that area? And a lot of times the answer is no. And the reason why, I'm going to give you an analogy. If you've ever like had a plumbing problem in your house, right? You call a plumber and they come out and, they do a terrible job. They don't fix the issue. The problem comes back just 2 days later, right? What you got was a bad plumber. And you didn't realize at the time that it was a bad plumber, but your experience led to the fact of understanding that plumber was bad. And then maybe you call another plumber and that plumber comes out and lickety-split fixes the problem, and that was a good plumber. How did you know which one was the bad one, and how did you know which one was the good one? It's like that in the medical profession, in the natural medicine realm, in the functional medicine realm. Sometimes you get people who don't know what the hell they're doing. I'm going to just be very frank. I mean, I see this. I go to a lot of conferences every year for postgraduate education, and I run into people regularly that don't belong in the room, like they don't have a knowledge set or a knowledge base that qualifies them to be in the room. And that's, to me, is a scary proposition because these people have patients. And so I really feel for their patients, but it doesn't mean that all doctors are bad either. A good one should be able to help you handle a malabsorption issue, but you've just got to do your diligence and make sure that you're finding one that has a great reputation that you can work with. Let's see here. Exocrine pancreatic insufficiency here, Laura says. Would love some help. So yeah, if you've got exocrine, first of all, I would ask how that was diagnosed. Because if you've got exocrine pancreatic insufficiency, most of the time it's diagnosed or it's identified by doing some testing. And so testing the enzymes like amylase and lipase, because those are produced by the pancreas. Amylase, lipase, and elastase are some of the more common ones. But if you've got pancreatic insufficiency, one of the best things you can do to support digestion is take a full spectrum digestive enzyme. Now, I have one called Ultra Digest if you want a gluten-free version of a good full support digestive enzyme. And so this is something you would take, you can take 1 to 2 caps prior meals. And the way you do that is about 10 minutes prior your meal to support your digestion. You're basically putting enzymes into your GI tract so that when the food comes, the enzymes are present in there and ready to help you digest that because your pancreas is underperforming. Now, it's important to understand that if you have pancreatic insufficiency, more than just taking digestive enzymes for the rest of your life, that you work with a doctor to try to help resolve why you have pancreatic insufficiency. And one of the most common reasons I see pancreatic insufficiency is got to do with gluten. Gluten is notorious for creating damage to the pancreas. Is it okay to eat squash and zucchini? Sure, those are not nightshades. It's okay to eat them provided you're not reactive to them. Let's see here. Yeah, so Tom's asking about a lab test. He says, lab test showed I'm low in B3 despite eating plenty of B3 rich foods. I'm taking a high quality multivitamin. I'm grain free. Any suggestions to increase absorption? So sometimes it's absorption. And if you're addressing your gut and your liver and your pancreas and your gallbladder, then no, you're not going to do much more to increase absorption outside of chewing your food more slowly and being in a parasympathetic state of mind when you eat. What does that mean? Parasympathetic is the part of your nervous system that helps you rest and digest. So what happens, a lot of people eat when they're amped up. They watch the news, right? In today's hyper-politicized world, and it's crazy out there. You can't listen to talk radio and you can't listen to the news and try to digest your food because you'll have a major problem with your digestion. So being in a calm state of mind, right? A calm state of mind where you're sitting, you're relaxing, taking deep breaths, you're taking the time to chew your food appropriately, you're taking time to smell the food and experience the food. Like the Europeans are great at this, the Americans frankly suck at it because the Europeans take time to eat their lunch and time to eat their dinner, right? And they're in an environment usually that's very happy and loving. And so, but Americans are on the run and on the go. So those are things you can do to improve your absorption, is just to basically activate and engage your parasympathetic nervous system. But beyond that, there's not a whole lot more you can do. But you got to also remember, if you were tested, there's 3 reasons we can develop nutritional deficiencies. Now, certainly malabsorption is one of them, or damage to the GI tract. One of them is not eating enough of a particular nutrient in the diet, in the food that we're eating. And another, though, is an underlying need for more of a nutrient when your body's going through a healing process. So don't forget that last one, because a lot of times as the body heals, it's using more of the nutrient as it's putting things back together. We have a greater demand for certain nutrients when our bodies are trying to heal. And so sometimes people develop a deficiency because their body is burning through nutrients faster than what it might typically use those nutrients if it were already healed and already fully healthy. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.